Homestead, Florida is the fastest growing city in the nation. But behind the facade of growth and prosperity, tens of thousands of South Miami-Dade County residents struggle to get by.
I work at Walmart for 7 years and 7 months. I take care of my mom on my 2 days off. I found out 2 to 3 years ago that I had diabetes. I can't afford my pills, my medicine, so I started going to Open Door.
Thelma is among the 25% of all Miami-Dade residents who lack health insurance. 70,000 uninsured live between Florida City and Southwest 152nd Street. South Dade actually has the highest concentration of the poor and uninsured in the nation. Fortunately, Thelma found help, hope, and healing at a free clinic, the Open Door Health Center.
I go to the diabetes class to find out about the nutrition, the exercise, and how to treat the diabetes that I have. And also, they're there to help me. Without them, I wouldn't make it.
Good morning, Mrs. Tange. How are you? Not too bad.
Open Door makes a huge difference in the lives of 2,300 South Dade clients who can't afford health insurance. Together, they account for up to 15,000 clinic visits each year.
Well, the clinic opened its doors in 2001. It's a project of collaboration created to serve those people that are uninsured and poor. We serve over 2,000 individuals, and we have had in these past 6 years over 45,000 visits to the clinic alone.
We started this building with a group of people, volunteers, that we were doing reconstruction on homes after Hurricane Andrew, and after that was completed, we moved to this site and built this building with volunteers.
In this community, this is a safe haven for those that don't have anywhere else to go.
By managing chronic illnesses such as diabetes, by focusing on women's health and prevention of disease, and by teaching strategies for healthy living, the most vulnerable members of society can often avoid expensive emergency room visits, visits to public hospitals paid for by taxpayers, or to private hospitals paid for indirectly by other patients through cost shifting. Open Door Diabetes Diagnosis and Treatment includes classes and support groups, supermarket tours to give hands-on experience in buying the right foods, and multicultural cooking classes to demonstrate the healthiest ways of cooking them. Senior fitness classes encourage good blood circulation.
Recently, I came to Miami as a musician, following my dreams. But right away, I started feeling the symptoms back again of diabetes. I always knew that I was diabetic for 2 years because I lost 160 pounds. And right away, the symptoms were back on me. I was in denial at the beginning, and not having insurance, I ended up at Open Door.
Open Door's Women's Health Program also emphasizes healthy eating and exercise. In addition, women are taught how to check for breast cancer and receive referrals for off-site mammograms and cervical cancer screenings. When you walk for the Susan G. Komen Breast Cancer Foundation, Open Door is where some of your donations are put to work. And we thank you.
Hace un tiempo atrás presenté una situación de salud, un cáncer de seno. No tenía ningún recurso para poderlo enfrentar, pero gracias a Dios Open Doors fue la solución, fue la entidad que me dio toda la ayuda. Me llevó donde cirujanos, donde médicos oncólogos, y a través de Open Doors hoy puedo decir que estoy sana, porque tuve la ayuda médica de todas estas personas que están detrás de ellos y me brindaron todo su apoyo. Hoy le estoy muy agradecido a Open Doors.
Open Door gives patients from kids to seniors free diagnostic services, free care, free medications, and free immunizations, plus free health education and nutrition counseling, both in English and Spanish.
They're very attentive. They look after your needs. And, of course, when you go in, it's a horse of different color because it's packed solid. It's a very wonderful place to be when you're ill. And, of course, the doctors are great, the associates are great, and the staff. They're well trained, and they're more like a family than outsiders.
More than 100 individuals and groups provide the funding that keeps Open Doors doors open.
One of the first applicants I met in my new position was the Open Door Health Center, led by Dr. Nilda Soto. and her passion and conviction to help the underserved in Deep South Dade, who needed access to primary care, was so convincing. Health Foundation went ahead and made a long-term grant, and we continue to invest today. It's been a great relationship, and we're very happy with Open Door.
Open Door operates on a $700,000 annual budget that supports 2 physicians, a nutritionist lifestyle coach, clinic manager, outreach workers, receptionist, and 3 medical assistants. A legion of big-hearted, dedicated volunteers are the biggest factor in Open Door's success. 120 doctors and 60 other licensed healthcare providers, including nurses, nurse practitioners, and therapists.
Seeing patients from Open Door Health Clinic allows me to give thanks and show my gratitude for everything that I have and return something to the community.
To continue its vital community service mission, Open Door needs additional volunteers and financial support. In fact, we need you. Find out how you can help.